Hello and welcome to the Dr. Brian McDonough Show. I have a very special guest today. It's Dr. Raymond Singer. Dr. Singer is Chief of Cardiac Surgery at Jefferson Einstein Montgomery Hospital. He has a large presence on social media. We'll talk about that in a little bit as well, educating people and talking to his patients. But what I want to do today primarily is have him talk about his book, I Used to Be an Athlete, the 3 E's for the Preservation of Youth. So my first question, Ray, is tell me about the book and why you decided to write it.
Well, as I say in the first line of the book is written for me. If any of the readers get benefit from it, that's terrific. But the person who probably would benefit from the most is its author. Like most of us, we were very energetic, youthful, athletic, maybe played on school sports or intramural sports during our junior high school, and then college comes and there's the freshman 15. We start to spend a lot more time studying and working, and we're eating about the same amount of food, but we're not necessarily exercising or as active. And of course, then we go on to getting our careers, perhaps getting married, having children. And again, we're used to the eating habits we have when we're young, when we're athletic. And then we find that we're exercising less, there's more stress in our lives, and we tend to put on weight and become a little less healthy.
I love the photo behind you, by the way. That looks like the Phillies locker room with their Hall of Famers. I've seen that before.
That's right.
It's great.
This was a gift to me from the nursing director of our operating room at Jefferson Einstein Montgomery. So she's a big fan, and it's great to be in Philadelphia. I was at Lehigh Valley Hospital for 27 years, which is a wonderful place to live and to work. And but coming back to Philadelphia, it's 100% Phillies fans. I don't have to deal with as many Mets or Yankees fans.
I want to talk about that a bit, not the fandom of New York and Philly, but the fact that you as a cardiac surgeon, I mean, people write books. They write books about the importance of good health. They talk about it all the time. To my extent, as a physician, family doctor, I see things I write all the time. But you're in there, you're operating on people, and you see the devastating effects of long-term, I won't even say abuse of the body, just the wear and tear and poor diet and those things. Tell me a little bit about how that contributes to it, to the issues that lead to surgery, and also about how the book can help.
Yeah, there's a lot of things we can do to improve our health. Sure, genetics plays an important role. But even with genetics, you can offset whatever cards you were dealt by taking better care of yourself. The concept of the 3 E's is very simple, and that's eating, exercise, and emotion. And I try to simplify things because I think we make being healthy a little bit too complicated. There are scores of books out there that have all kinds of theories on, what specific type of diet and this and that. And yet I provide some very simple thoughts on how to eat well, the times of the day to eat, how to exercise without necessarily needing to join an expensive gym. And lastly, and perhaps most importantly, emotional health. I think we can all agree we live in times that are much more treacherous than in the past. Things are a lot more stressful for a lot of people. And if you don't have good control of your mental well-being, then you're never going to be able to take care of your physical well-being.
It's really interesting you bring up the emotional part, and I was going to get to that, but since you brought it up, I'll ask you now. A lot of people, as they're getting older, and this book is for any age group, but because like you said, once you put on the freshman 15 or so, right, it's kind of off to the races in a negative way. So anybody can benefit, but as people get older, the emotional part becomes very important because life changes. Maybe for older couples, the kids are gone and they're kind of bored, or they feel, what's my purpose? Or people who are younger, they've got the kids and they're thinking, I don't do anything for myself. And it's easy to get into a rut. Can you talk about that?
Yeah, I mean, I call it that certain someday. We study hard in high school and take our SATs to get into a good college. We study hard in college to get into a good graduate school or to get a good job. And then we get out into the workplace and we work hard. often staying late hours so that we can make partner or become a professor or whatever your field of profession is. And the fact is, we keep thinking that if only I do this, then I'll get to that certain someday, and then I'll be happy. And what we forget is along the line, in order to be happy, you have to be healthy. And I talk about this triangle, it's equilateral triangle with mental health at the top, and then the base of the triangle is eating and exercise. And so I think it's important that, the old saying is, it's a journey, not a destination. And that's the same with health.
One of the things I also want to talk about, I know in my career, as I've kind of weaved through different stages, now I'm doing a lot more education in a clinical setting for young doctors. And I'm finding it very rewarding, and I enjoy it. It's good for me, and it's certainly fulfilling for me and on the emotional part. But what I'm also noticing is younger physicians, and I think this can go across the board, have been impacted by the environment, whether it's the times during COVID or other issues. There seems to be a lot more anxiety out there. Have you noticed that as well with your patients? Because clearly anxiety can lead to stress. Stress can lead to inflammation and all those other issues that can affect your health.
Yeah, Brian, you're spot on. Inflammation is a key part of this, and it does come from stress. It does come from anxiety. As you may well know, there's even an entity known as stress-induced cardiomyopathy. It's also known as Takotsubo syndrome. Takotsubo it's an octopus trap. It was described in 1991 by the Japanese, where it has a very narrow neck and it balloons out, or a big, large bowl. And that's what happens to the heart. The sudden surge of hormones, such as adrenaline in your body, can have a direct deleterious effect on the myofibrils of the muscles of the heart. And the heart stops contracting and it dilates out, and it's not functional anymore. And people can actually die from it. And it's stress related. In fact, it gives new credence to the phrase, he was scared to death, or she died of a broken heart. And so that's perhaps the extreme. But on a daily basis, when we have the combination of eating foods that tend to cause inflammation, when we're pumping ourselves up with excess additives or caffeine, when we're more, we're sitting around more, we're on our phones, we're not exercising, we're not walking. And then in the back of that, there's this milieu of anxiety and stress, whether it's due to COVID or world events, political concerns. Little by little, it chips away at your vessels, and it literally can injure the lining of the vessels and the lining of the heart muscles. And over time, this constant vigilance just creates higher blood pressure, more inflammation. It becomes a vicious cycle. And then the tissues break down, and it can lead to damaged tissues. It can lead to heart disease, heart attack. And some people, it's not my area of expertise, believe that it contributes to even cancer.
This is the Dr. Brian McDonough Show. My guest is Dr. Raymond Singer, author of I Used to Be an Athlete. You can get that book, Amazon, anywhere you want to look. It's out there. You can pick it up. But I think you can already see that Dr. Singer is very good at explaining complex topics and making them sound less complex, which is really helpful when you're trying to share health information. I want to talk about that as well. I know that you've written this book, but you're on social media. You sometimes, with their permission, focus on patients who you've performed surgery while they're recovering. And I know you always make it clear this person agreed to do this, or this person wanted to share their story. But tell me a little bit about how using social media helps educate people about your area, of course, which is heart disease and complications that can arise.
A lot of people forget, in my day growing up, social media was the newspaper, the op-ed page. And I have actually written approximately 60 plus op-eds for various newspapers, mostly the Morning Call in Allentown when I was working at Lehigh Valley Hospital all those years. In 1999, I launched my website, which is heartlungdoc.com, heartlungdoc.com. And it was just a page or two. You think about how early that is as an early adopter. 1996 was Google. and Facebook was 2004. So 1999 was very early in websites. And I used it as an educational tool because when you go to see your doctor, particularly a specialist, you're talking about heart surgery, I try to give the patients as much time as I can, up to an hour for initial consultation. But patients are nervous when they're in your office. They often will leave saying, oh, I forgot to ask this, I forgot to ask that. So one thing I do, I happen to give my cell phone out to every single patient. I've done that since there were cell phones. But the website allows the patients to go back and review what we talked about in the office, because almost everything that we talk about in the office is on my website. And of course, there's a lot of links and other things. As we move forward and COVID hit, it was actually my two daughters and my nephews who told me about TikTok. I really didn't know much about TikTok. The little bit I knew, I didn't think it would have any role in healthcare. But I started to talk about COVID. And the very first video I made had over 800,000 hits in the first couple hours. I thought, wow, this is something. And if I can reach that many patients that quickly, maybe I will start to segue into stories about mitral valve repair, coronary artery disease, what it's like to have coronary artery bypass surgery. Now, you point out something very important, is that you have to be very careful with that. So first, I don't do anything without reviewing it with my hospital, with the marketing department, senior management, and yes, even legal affairs. And there are consents that need to be gotten, and there are things that you can say and things you can't say when you're doing social media with patients. I'm fortunate, I've had a lot of experience with it. My caution to young doctors is to make sure that you do go through the learning process and understand what's safe. I give a grand rounds talk, which grand rounds are just a large lecture, and it's entitled Social Media, the Good, the Bad, and the Ugly.
You talk about that. It's quite interesting. I know during COVID as well, the ability to continue to provide information without raising a lot of controversy was difficult too, because as physicians, the last thing we want to do is alienate people.
You'll be happy to know, since you're a primary care physician, that originally I wanted to be a family doctor. And I always say I started hanging out with the wrong people and I became a heart surgeon. So hopefully I'm a family doctor on the inside, a heart surgeon on the outside. And what I mean by that is that your family doctor really has a great 30,000 foot view of your health. And I think sometimes patients tend to go from specialist to specialist when they really should be conferring with their family doctors. And that includes management of their blood pressure, their lipid and cholesterol, and their exercise, eating. The single most common question I get from patients is, Dr. Singer, if I lose weight, if I eat better and exercise, can I prevent heart disease? Can I prevent needing heart surgery? And the answer that I always give is that, genetics plays an important role, and we can't pick our parents. However, those patients who actually do take care of themselves, who eat well, exercise daily, and have good emotional health, are more likely to do well when they're faced with their destiny, when they're faced with their genetics. My mother had valvular heart disease and coronary artery disease. She had a valve replacement and bypass surgery. I have slight leaking of the same valve that she had to have replaced, and I have some hardening of the arteries. I just turned 67. It's not surprising. But the point is that those patients who are focused on their health, when they're faced with whatever obstacles they may find, whether it's surgery or a stent, God forbid if they're faced with cancer, they're the patients who take care of themselves, who think about the 3 E's, eating, exercise, and emotion, their whole lives, and have lifestyle changes. Those are the patients who are most likely going to recover more quickly and go on to have a continued quality of life and longevity.
Dr. Raymond Singer, I want to thank you for taking the time to join me on the program. Dr. Singer is the author of I Used to Be an Athlete, The 3 E's for the Preservation of Youth. I think it's a great book, and certainly recommend it for our viewing and listening audience. But thanks for taking the time to join me on the program.
It's my pleasure, Brian. Thanks for all you do. I listen to you on KYW News every single morning.
Well, I appreciate that. Thanks for listening too.
Okay.
Have a great day. And for everyone watching and listening, thanks for you taking the time too. Hopefully you find this helpful. Have a great day.
Okay. Thank you, Brian.